Shabbat Shalom. Nora Fromson suggested that I do this Devar Torah back in April, and I thought, how fabulous. Then I realized what information and experience I'd had to sort through, and I thought, oh dear. So, the first tidbit of information I'll share is that I've discussed this with the second-year Neomed, formerly Neo-UCOM, students for over 25 years. I could tell them everything I knew for the first couple of years, and then over time that became impossible. It took another few years for me to realize that this was okay. Likewise, there's no way I can tell you everything in a 10 to 15-minute speech, and that's okay. If you have any questions at any time later on, I'll be glad to answer them. This begs the question of what do I talk about to the Neomed students? I'm what's called a standardized patient. I've attended what's traditionally been called Sexy Saturday, where the second-year students learn how to take a sexual history of their patients. My role is that of a female-to-male transgender patient, but this isn't simply a role I play for the students. It's my actual lived experience. So, in case you didn't know before, I am an honest-to-goodness female-to-male transgender person. I came out the first time as a gay female back in 1988. I was wondering if I was trans then, but the politics of the time were that trans people were reinforcing gender stereotypes, and we were all one happy androgynous family, so I put those feelings on the proverbial back burner. I started attending Cleveland PFLAG meetings, Parents, Family, Friends of Lesbians and Gays, and PRISM, Presence and Respect of Youth and Sexual Minority meetings, and became involved in the Cleveland gay and lesbian community until I graduated from Cleveland State University in December of 1991 and moved back to Akron. I say gay and lesbian community because the bi and trans had not yet been added to the acronym at that time. I then started attending the Akron PFLAG meetings where I first met the Horowitzes and the Schoenfelds in 1992. I continued self-identifying as a gay female, but I still had this underlying idea that there was a masculine sense of self that wasn't being addressed. However, gender identity still wasn't discussed at that time, and so I kept my feelings hidden. Then, in 1993, two watershed events for the trans community happened. The first was the Brandon Tina murder, on which the movie Boys Don't Cry is based. It's to the trans community like what the Matthew Shepard murder was to the gay community. It helped galvanize community support. The second event was the publication of the novel Stonebutch Blues by Leslie Feinberg. For the latter, I was at an Akron PFLAG meeting when we had a guest speaker, Buck Harris, now of blessed memory, who had his own radio show in Cleveland and had mentioned drag kings in passing. Hello! I had figured that if drag queens existed, then there probably had to be drag kings too, but I had never heard of any until then. When we took our break at the meeting, I asked him about it and he told me about the above-mentioned book. I purchased a copy, read it, and it brought back those feelings that I had suppressed earlier. I realized that I was in fact trans, so I started counseling that fall. I genuinely thought that a year of counseling was required before I could start any physiological treatments, but I later found out that I only needed 3 months. In hindsight, I was glad I took that extra time because it allowed me a chance to backpedal, ask myself if I really wanted to go through with this, and to conclude that, yes, I needed to transition. I realized that I also needed pastoral counseling as well, as I was concerned that I was essentially mocking God by transitioning. After all, I had developed normally as a female. I was having periods with cramps and was otherwise functioning properly. The Lutheran pastors I went to weren't able to help me all that much, so I went to see Rabbi Horowitz since I knew him from PFLAG and that he would at least be sympathetic. After discussing my situation, he said that he didn't think that God was mad at me for wanting to make this transition, and that was very helpful. Thanks, David. I started taking testosterone injections on December 30th of 1994 and started my real-life test of living as male. As of my standing here this evening, I've been on testosterone for almost 28 and a half years and for over half of my lifetime. During this time, I became familiar with the WPATH, the World Professional Association of Transgender Health, Standards of Care Guidelines. WPATH is a consortium of various health professionals who set the standards of best practices in the medical procedures of transitioning for transgender people, say that 3 times fast, and those best practices have changed over time as more information has become available. For example, it used to be that a female-to-male person like myself had to have been living full-time for at least a year before having top surgery, that is, breast removal. However, there was a realization that men who had double D-sized breasts had considerable difficulty in hiding them, especially during the summer, so that rule was relaxed. I'll discuss more on WPATH shortly. I had my top surgery and hysterectomy in December of 1998. I had them done at the same time because it cut down on the overall cost to have them done together. Insurance did not yet cover this, so this was paid entirely out of pocket. I was fortunate to have them done locally at Akron General, and I was also very fortunate in that my parents were willing and able to look after me while I recovered. I cannot tell you how many stories I've heard from people whose families have rejected them for being LGBTQ+, so I am really lucky. I then had my bottom surgery, that is my genitoplasty, in April of 2001. I traveled to Montreal, Canada to have the procedure done because, one, there weren't many surgeons in the U.S. who did the procedure. Two, if they did, it was horrendously expensive. This was paid out of pocket again. And the monetary exchange rate for Canada was favorable. Three, the doctors there had their own private clinic, which meant more privacy. And four, Canadians utilize these convalescent residences, which are home-like places where a person can stay as they recover from a procedure. Having the surgery done in the U.S. would have meant interstate travel and an overnight stay at the hospital. I would have then been discharged the next day and have had to recover at a hotel where hopefully the person who traveled with me knew something about postoperative care. I traveled to Montreal on April 1st, had the surgery on the 3rd, and returned home on the 23rd. That's the story of my transitioning. Now I'm going to segue into discussing what's now going on legislatively, specifically in Ohio, and overall to some extent. I'll discuss trans athletes first, but I need to define something. The term cis, C-I-S, means on the same side. So to help you out with that, I'm trans, but I believe everyone else in this present in this room is cis, so that should help you out there. Many people say that cis males have an unfair advantage over cis females and therefore should not be allowed to participate in women's sports. This is where I'm going to show that the trans community is not monolithic in our viewpoints. I studied sports medicine and athletic training for my first few years of college, and I've learned that there are some musculoskeletal differences in the bodies of mature men and women, such as the Q angle of the pelvis, knee, and tibia. Does this difference matter in sports where there's a lot of running? I don't know. However, I've heard from male to female friends that their strength took a nosedive downwards when they started their feminizing hormone replacement therapy. I also understand that the NCAA guideline on when male to female athletes are eligible to play women's sports is at least 1 year on feminizing hormone replacement therapy, along with a blood test showing lower testosterone levels comparable to Swiss women's levels. My own personal thought is that this should be handled on a case-by-case basis if the person has gone through cis male puberty. Considering that the number of male to female trans athletes are in the single digits here in Ohio, it should not be difficult to determine eligibility on a case-by-case basis. I have not heard of any issues regarding trans men, like myself, competing with other men, as everyone involved has testosterone either endogenously or exogenously supplied. Next, Ohio House Bill 8 would require school staff to call students by their birth name and whichever gender markers on their birth certificate. Moreover, the staff would be required to notify the student's parents or guardians if the students request to be called by a different name and pronoun. How would you feel if you were denied your correct name and pronoun? There's a real danger to these students if the parents or guardians are not supportive due to religious or other reasons. School may be the only relatively safe haven for these particular kids. Ohio House Bill 68 would ban gender-affirming care for youth. There are those folks who worry about irreversible HRT and or surgery being performed on people who are too young to consent to such procedures. There is some validity to this notion of irreversibility. I could never take another testosterone shot in my life, and I'll always be able to sing baritone. My voice will never change back to the mezzo-soprano range that I once had. I'll also always be able to grow a beard unless I have electrolysis done. Having said that, I had mentioned that I would be discussing WPATH again, and here it is. WPATH already does not recommend cross-gender hormone replacement therapy along with gender-affirming surgical procedures until a person has reached the age of majority. However, puberty blockers may be used on people who are at the Tanner stage 2 level of puberty. These blockers are also used for cisgender kids who are undergoing precocious puberty and have been found to be effective. Bills in other states have been proposed that trans people should not be allowed to access treatment until the age of 26. However, people who are 18 years old may consent to procedures such as breast enhancement or reduction, rhinoplasty, that is a nose job, tummy tucks, and various other cosmetic procedures, along with consenting to have piercings or getting tattoos. What these proposed bills do is create a double standard of what can be done for one set of people versus another set of people. Ohio House Bill 183 would restrict restroom and locker room access in Ohio schools and universities to people's birth-assigned sex. Let's think about this. Would a cis person go through years of counseling, hormone replacement therapy, a legal name change, telling family and friends about the change to a new gender expression with the risk of losing them? All this, at the very least, just to be able to go into the locker room of the other sex? I'm sure you'd agree that they wouldn't, and it shows how ridiculous the hysteria is. In closing, I'd like to share how I've seen change for good in the LGBTQ+ community. When I was at Cleveland State in the late 80s, early 90s, we would hang up signs for the SAS, Student Alliance for the Support of Sexualities, student group, and they would be torn down or deliberately covered up by the next day, if not before. Likewise, there would be banners from various student groups, fraternities, sororities, and international student groups hung in the student center. Once, the CSU Gay Men's Support Group had an approved banner hung up in the CSU Student Center, and it was torn down within 20 minutes. Many of you remember that that's how things were back then. Then I was back in school at Stark State in the late aughts. One time I passed by a GSA, Gay Straight Alliance, a flyer that was on a bulletin board in a busy hallway, and I thought how lucky I was that I was able to see it after it had evidently just been put up. Then I went past the same spot a day later, saw the flyer, walked past, and did a double take. It was still there. And then it was still there the next day, and the next week, and the next month, and it was looking kind of ratty, but it was still there. I was so pleased to see how LGBTQ+ postings were accepted as no big deal and as ordinary as any of the other flyers. I've not been on a college campus in a few years, so I hope that these flyers are still regarded as the same as other student group flyers. However, this experience showed me that things did indeed change for the better, and may they continue changing for the better. Shabbat Shalom.